Did you know that the very aspirin you take to relieve pain could be causing serious harm to your stomach? That tiny pill you rely on might be leading to conditions like peptic ulcers and gastritis, affecting millions of people worldwide. In this video, you'll learn what aspirin is made of, its common uses, and how it impacts your stomach. We'll discuss the differences between peptic ulcers and gastritis, dive into the detailed mechanism of how aspirin causes these conditions, and share essential tips on how you can protect yourself. So, what's the real story behind aspirin and your gut health? Let's dive in and find out. Hi, I am V, and welcome to the Best Health channel on YouTube, where we talk about everything related to your health and well-being. Give this video a thumbs up and do not forget to subscribe for future videos. So what exactly is aspirin? Aspirin, also known as acetylsalicylic acid, is a medication that has been around for over a century. It's something many of us have in our medicine cabinets, but how much do we really know about it? Aspirin is derived from salicylic acid, a compound found naturally in plants like willow bark. In fact, ancient civilizations used willow bark to relieve pain and reduce fever. Fast forward to the 19th century, scientists figured out how to synthesize acetylsalicylic acid, making it more effective and easier to produce. That's how we got the aspirin we know today. Now let's talk about the many uses of aspirin. It's quite the multitasker. Pain relief. Aspirin is widely used to alleviate headaches, muscle pain, toothaches, and menstrual cramps. It works by blocking certain chemicals in the body that cause pain and inflammation. Anti-inflammatory. Due to its anti-inflammatory properties, aspirin is also used to treat conditions like arthritis and other inflammatory disorders. It helps reduce swelling and provides relief from chronic pain. Fever reducer. Aspirin can lower a high fever, making it a go-to remedy for flu and other febrile illnesses. Heart attack and stroke prevention. Perhaps one of its most significant uses is in the prevention of heart attacks and strokes. Aspirin helps by preventing blood clots, which can block blood flow to the heart or brain. Doctors often recommend low-dose aspirin for individuals at high risk of these conditions. Preventing blood clots. Beyond heart attacks and strokes, aspirin is used to prevent blood clots in certain medical conditions and after surgeries, especially in people with a history of clotting disorders. Reducing the risk of certain cancers. Some studies suggest that regular use of aspirin might reduce the risk of certain cancers, particularly colorectal cancer. However, this is an area where you definitely want to consult your doctor before starting any aspirin regimen. Aspirin's versatility and effectiveness make it one of the most commonly used medications worldwide. But as beneficial as it is, it's important to understand how it works and the potential risks involved, especially for long-term use. Now that we've covered the basics of what aspirin is and what it's used for, let's dive into how it can impact your stomach health. Let's shift our focus to two conditions that can be significantly affected by long-term aspirin use: peptic ulcers and gastritis. Peptic ulcers and gastritis are both related to the stomach, but they are quite different in nature. Let's break it down. A peptic ulcer is an open sore that develops on the inner lining of your stomach or the upper part of your small intestine. These ulcers form when the stomach's protective mucus layer is compromised, allowing stomach acid to erode the tissue. Symptoms of peptic ulcers include burning stomach pain, which can be worse when your stomach is empty, nausea and vomiting, bloating and burping, weight loss and loss of appetite, in severe cases vomiting blood or having black tarry stools. Gastritis, on the other hand, is the inflammation of the stomach lining. This inflammation can be acute, happening suddenly, or chronic, developing over time. Symptoms of gastritis can include upper abdominal pain or discomfort, nausea and vomiting, a feeling of fullness in the upper abdomen after eating, indigestion and heartburn, loss of appetite. While both conditions involve the stomach, the main difference lies in their nature and causes. Peptic ulcers are more about actual sores or holes in the stomach lining, whereas gastritis is about inflammation of the stomach lining. Peptic ulcers often have more severe and distinct symptoms like sharp, burning pain and can lead to serious complications if untreated. Gastritis, though uncomfortable, tends to have more general symptoms like indigestion and nausea. Understanding these conditions is crucial because they can significantly impact your quality of life and overall health. If left untreated, peptic ulcers can lead to severe complications such as bleeding, perforation, and even gastric cancer. Gastritis can also lead to ulcers and increase the risk of stomach cancer. Now that we have a clear picture of what peptic ulcers and gastritis are, and their symptoms, we can better understand how aspirin use can lead to these conditions. Now let's dive into how aspirin, a seemingly harmless pill, can lead to serious conditions like peptic ulcers and gastritis. Aspirin works by inhibiting an enzyme called cyclooxygenase, COX. There are two main types of COX enzymes, COX-1 and COX-2. COX-1. This enzyme is found in most tissues, including the stomach lining. It plays a crucial role in producing prostaglandins, which help protect the stomach lining by promoting the production of mucus and bicarbonate, which neutralize stomach acid. Without them, your stomach acid will dissolve your stomach. COX-2. This enzyme is primarily involved in the inflammatory response, producing prostaglandins that mediate pain and inflammation. When you take aspirin, it inhibits both COX-1 and COX-2 enzymes. While inhibiting COX-2 helps reduce pain and inflammation, inhibiting COX-1 reduces the protective mucus layer in the stomach. Without this protective layer, the stomach lining becomes more susceptible to damage from stomach acids, leading to irritation, inflammation, gastritis, and even the formation of ulcers. Understanding the prevalence of these conditions can help underscore the importance of this issue. Peptic ulcers. Research indicates that long-term aspirin use increases the risk of developing peptic ulcers. Studies have shown that around 10–20% of chronic aspirin users develop peptic ulcers at some point. Gastritis. The prevalence of gastritis among aspirin users is also significant. It is estimated that approximately 30–50% of long-term aspirin users experience some form of gastritis. These statistics highlight the substantial risk posed by prolonged aspirin use, especially without proper medical guidance and preventive measures. Now let's move on to discuss how you can protect yourself from these risks while still benefiting from the positive effects of aspirin. Alternatives to aspirin. Acetaminophen. For pain relief, consider acetaminophen, which does not have the same gastrointestinal risks as aspirin. Other NSAIDs, some non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, might be used as alternatives, but they also carry some risk of stomach issues. Protective measures. Take with food. Always take aspirin with food to help reduce stomach irritation. Enteric-coated aspirin. Consider using enteric-coated aspirin, which is designed to pass through the stomach and dissolve in the intestine, reducing direct contact with the stomach lining. Proton pump inhibitors, PPIs. Your doctor may recommend PPIs, which reduce stomach acid production, thereby helping to protect the stomach lining. Regular monitoring. Regular checkups with your healthcare provider to monitor for any signs of stomach problems. Always consult with your healthcare provider before making any changes to your medication regimen. They can help you balance the benefits of aspirin with the need to protect your stomach health. By understanding the risks and taking proactive measures, you can continue to benefit from aspirin's many positive effects while minimizing the potential for harm. As we wrap up, let's quickly recap the key points we've covered. Aspirin. We explored what aspirin is, its chemical composition, and its various uses, from pain relief to preventing heart attacks. Peptic ulcers and gastritis. We defined these conditions, highlighted their differences, and discussed their symptoms. Mechanism of harm. We explained how aspirin inhibits the COX-1 enzyme, reducing protective prostaglandins in the stomach lining, leading to increased risk of peptic ulcers and gastritis. Statistics. We looked at how common these conditions are among long-term aspirin users, with significant percentages developing peptic ulcers and gastritis. Protection tips. We provided practical advice on how to protect yourself, including alternatives to aspirin, taking it with food, using enteric-coated versions, and consulting your healthcare provider. If you found this information helpful, please give this video a thumbs up and share it with others who might benefit. Don't forget to subscribe to my channel and hit the notification bell so you never miss an update. Your support helps me continue to create valuable content for you. By understanding the risks and taking the right precautions, you can safely use aspirin and protect your stomach health. Thank you for watching and stay healthy.